Okay, aspirin, acetylsalicylic acid is a common name for aspirin, very common generic. Yep. Class is a platelet inhibitor. It is also a non-steroidal anti-inflammatory drug, or an NSAID. The mechanism of action for it is it irreversibly blocks the formation of thromboxane A2 in platelets, which prevents platelet aggregation for the life of the platelets, usually 8 or 9 days. So it just keeps those platelets from clumping up and forming blood clots. And once it binds to them, it can't be changed, can't be undone. It just has to, it's there till those platelets are then broken down and regenerated, which takes a little over a week. It also inhibits COX-1 and changes COX-2 enzymes, which will cause anti-inflammatory and analgesic effects. So it does two different things there, and both very beneficial in certain instances. Pregnancy class is D, and anytime we're given that with acute coronary syndrome, we of course treat the mother over the baby, because if the mother doesn't survive, the baby obviously won't survive. So treat that mom. Indications: chest discomfort suggestive of ACS or acute coronary syndrome. Contraindications: active ulcer disease, and then kids, especially those with flu-like symptoms. And anytime we are treating the kids with the flu-like symptoms, then we are worried about the Rise syndrome, which is an adverse reaction. And that's why we avoid giving aspirin to any kids, especially those with flu-like symptoms, because it can bring on Rise syndrome, which can cause swelling of the liver and the brain. It's not a good deal. So avoid use in the kids. Some adverse reactions: prolonged bleeding, of course, if we're messing with their platelet aggregation and clotting abilities, I should say, then it's going to cause some bleeding issues. GI bleeding, it can cause that, and then nausea, vomiting. If someone is already on a blood thinner, just any blood thinner, and then they start having chest pain, we can go ahead and still give aspirin. Their use of blood thinners is not a contraindication for us. Drug interactions: use caution with anybody who's allergic to NSAIDs, of course. As with all drugs, don't ever give it to somebody who's allergic to it. Adult dosage: 325 milligrams PO, which means just taken orally and then preferably chewed up, or if they don't have teeth, have them gum it. Don't use it in the kids, of course. Onset's 5 to 30 minutes, peak effects in 1 to 3 hours, and then duration, as we mentioned, it irreversibly binds, so it's in the system for 8 or 9 days. Special consideration, the only thing really is we want to make sure we are giving them right around 325 milligrams in the past 24 hours. So a lot of times these patients are taking 81 milligrams on their own each day, so then we go ahead and give them 3 more baby aspirin, so it brings them up to a total of 324 milligrams in 24 hours. And that is about it with aspirin.